Morocco needs 83,000 more healthcare professionals just to meet the World Health Organization's minimum standard. Not want, need. That is not my opinion. That is the Moroccan Ministry of Health's own internal report published this year. I am one of the thousands of students training to fill part of that gap. And statistically, 7 out of every 10 of us in our final year are already planning to leave the country the moment we graduate. I am one of them. This video is the data behind why that happens and what would actually change it. My name is Yassin Moradi. I am a healthcare student at one of Morocco's healthcare or nursing institutes. Everything in this video is sourced ministry report, WHO data, peer-reviewed research. Nothing here is a guess. 3 parts. Let's go. The actual numbers, point 1. The actual numbers, the workforce gap. Right now, Morocco has 2.2 healthcare workers per 1,000 people. The WHO's critical threshold is 4.45. We are at less than half of where we need to be. The ministry's own number for the total gap, 83,000 professionals. 27,000 doctors, 55,000 nurses and healthcare technicians. The second idea in here is that the doctor-specific crisis. Morocco has roughly 0.8 doctors per 1,000 people. France has 3.4. This is 4 times fewer doctors per person than the country right across the water. The ministry's own estimate for the doctor shortage alone, 30,000. The third idea is that the number that hides inside the average. More than half of Morocco in this country work along one corridor, Casablanca to Rabat. Outside that corridor, 270 rural communities are more than an hour from any hospital. 160 of those are officially classified as priority zones. That is 2 million people. The national average is hiding a much worse story for a lot of this country. The second point in this is that why the system produces this outcome. Not blame, structure. The first reason in here is that training more people is not the same as keeping them. Nursing training spots have grown from 2,700 to 8,300 since 2019. That is real. This is 200% increase. But here is the structural problem. You can triple how many people walk through the training pipeline if the conditions on the other side have not changed enough. You are just training people faster for the same decision to leave. The second idea or reason for this is the brain drain numbers and why, or my own admission. 71% of final year medical students intend to emigrate after graduating. 47% of all health professionals say they are willing to leave. I need to be honest with you here. I am one of them. This is not a video where I point at a statistic from a safe distance. I am the statistic. And the third reason, this is a pull, not just a push. Germany's number for foreign doctors went from 30,000 in 2013 to 64,000 in 2023. And that is 14% more of their entire medical workforce. Other countries are not waiting for Morocco to fix this. They are actively recruiting the people Morocco trains. This is not only a failure to retain, it is a competing against active demand. The third idea that I have is what would actually fix it. What is genuinely already working And I want to be fair here. Salary reform tranches are already landing. In 2026 pay slips, right now, 8,000 new positions were funded this year alone. The territorial restructuring of the health system, the groupement sanitaires territorial, is actively underway. This is not a system doing nothing. The reform is real. The second aspect of this, but two gaps have not closed. More graduates does not fix the Casablanca-Rabat concentration. And here's the number that should worry policymakers most. That 71% immigration's intent figure has not moved despite the reforms. Which tells you something specific. The fix is not only salary, it is working conditions, it is professional protection, it is the absence of a national nursing council, meaning an infirmier can be held legally responsible for decisions that were never in their scope. It is respect for the role. Third aspect of this, the forward-looking fix and where I fit into it. Morocco has had a legal framework for telemedicine since 2015, mostly unused. That is a real lever already sitting there to reach those 270 isolated communities without physically relocating a single doctor. And here is the personal part. I am about to become part of that immigration number. But immigration does not have to mean pure loss. Circular migration models, structured return programs, this Pora partnership can turn people like me into a bridge instead of just departure. That is the version of this I'm trying to build. So here's the full picture. The gap is real. 83,000 professionals short, at less than half the WHO standard. The reform is also real, salaries rising, positions funded, capacity expanding. And the parts still missing, working conditions, rule distributions, and using tools like telemedicine that already legally exist. I am not making this video to complain. I am making this, or I'm making it because I am about to leave and I wanted to be honest about why. Why the actual data behind it? What is it? Subscribe if you want to follow where this goes. And see you in the next one. Subscribe.